Welcome yet again. I'm with Sameexa Sood. Thank you for accepting my invite, Sameeksha. I know you're a friend of a student I have worked with, and both of you had decided to go to Delhi University. And that's not a bad decision given where the world of studying abroad is today. So it's just great to meet students who are multi-talented and are using their knowledge, skills, and values and beliefs to bring about so much change. Tell us a little bit about your journey from school to college, and how did you end up choosing a career in public health?
Yeah, hi Arjun. Thank you so much for having me. So, back in school, after the 10th grade, I knew that I really liked three subjects: political science, economics, and mathematics. So that is what I eventually ended up taking up along with English and sociology. And I think these subjects really helped me understand a lot of changes that were happening around me, put things into perspective. So that took me to Ramjas in Delhi, where I did economics and political science. And I also was a part of a couple of clubs which were on social entrepreneurship, and I volunteered with a couple of impact organizations. And that is where I understood that I wanted to go deeper into the grassroots and do more than what the Delhi ecosystem of impact space can offer, which took me to a district in MP where I'm working with the government frontline workers and stakeholders to improve service delivery in the public health space.
Okay, so service delivery in the public healthcare space. It's like a mouthful, right? So let's break it down. What exactly is the on the ground implementation that you're part of?
Okay, so government already has certain stakeholders, certain frontline workers that work at the grassroots, right? There's ASHA workers, Anganwadi workers. There are two major departments that work in the health service delivery. There's the health department and the ICDS department. Both have different mandates. Now, the problem mostly is that there is not a lot of interdepartmental convergence, or there are systems which dilute when they come from the national to the state to the district and then eventually to the block level. So then the government has certain development partners which help them ensure the quality of the services that are being provided. So what I normally used to do in the role we're talking about is I used to work with, there was a block where, so it had the maximum home deliveries in the entire MP state. What we were doing is we were trying to develop a home delivery prevention model, and in that basically meant going with a lot of ASHA workers, Anganwadi workers, talking to communities, coming back, doing agenda-based reviews, seeing the data, and then helping them do the service delivery in a much systematic way.
Okay, so when you say home delivery blocks,
Yeah.
and what would you home deliver?
Oh, babies, children.
Okay,
Yeah.
okay, fine. Fine. So there was this whole basically home-based natal care.
Yes, yes, home-based postnatal care. That's a whole program that the government
Yes.
is running.
Okay. So, with the age of Zeptos and
Yeah, I realize I'm
you
just too
wouldn't deliver
comfortable.
babies. You are not the one who's delivering babies. There
Yeah.
are others. You're just making sure uh, some of the uh, some of the maybe healthcare
Just
support
making sure that
workers.
people reach the right institution at the right time with the right support.
Okay, so fine. And since these deliveries are happening at homes, so there are field workers who even prenatal and postnatal care, they
Yes,
do many things. And so,
yes.
and how do you measure success for the team?
So, an ASHA, so there's a whole health cost infrastructure. At the base of it is an ASHA worker who is posted at every village. Her responsibility is right from a woman, actually, even before that, but what I worked in at, right from a woman gets married, you have to start tracking the times that she can miss a period and when she might be pregnant. And from there starts the whole 1,000 days of services that she has to get, which is right from the time she starts her pregnancy to the time when the child turns 2. There are like a series of services that she has to get in the first 3 months. There are a couple of checkups. Like there's a whole routine of the kind of checkups, vaccinations, uh, visits to the district facilities that have to happen. And mostly in the places we work, people are maybe not aware, maybe there are documentation issues, maybe there are livelihood issues, a lot of migration issues due to which people cannot actually access the care that is available there. So there are frontline workers who ensure that people are registered in the system, know what kind of facilities are available, and have all the resources to reach the institution when they have to. And then after delivery also, there's a whole nutritional program that then the ICDS takes over.
Okay, and you've been at Antara for quite a few, like at least like 2 years for sure, full time.
Yeah.
Now you're a consultant there, so does your responsibility change? Do you also have to much upskill and develop more knowledge and abilities? What are those skills that you would need? How do you define like growth in an organization which is in public health in India? So as a program officer, what are the responsibilities and how does it change as you grow?
So I wouldn't say that from a program officer to a consultant is a very linear growth. It's not. Actually, I had taken a gap and I wanted to come back for a few months because I was evaluating other options as well. That is how the consultant sort of stint started. As a program officer, my role was essentially limited to a particular block and a district where all the officials knew that this is one person who will be helping us for XYZ things, and that is what I had to deliver. So almost 4 days of a week, I was on the field with the government stakeholders, trying to problem solve, trying to make systems thoda smoother as much as I could. But as a consultant, I've shifted to a more of a demand side role. So, there's a distinction in public health between supply side and demand side. Supply side is more when you work with the government to strengthen the existing public health delivery systems. Demand side is when you realize that the government can only encourage people or can only provide them with the incentives to come to an institution, but the end choice always lies on the person who has to take the service. If a person has decided they want to have a home delivery, you cannot force them to come to an institution. So now as a consultant, I'm working on this project, which is also a pilot project. It's not a complete program, unlike the previous one I was working on. This is more of trying to understand the different platforms which we can enable in a particular block where the supply side is already strong, so that we can see how to strengthen the demand and how can people now access services. So what has happened is when we were working on the supply side, we realized that there were barriers like road access, there were barriers like network connectivity, barriers like decision making power not with the direct person who has to reach the institution. And these are problems the supply side cannot solve for. So then there had to be a community or a demand side project which brought people together so they can demand for whatever they want, and the government can then come and integrate their services there.
Okay, so would it be right to say that a degree in economics, political science has some advantage in terms of really understanding issues, but what is taught is not necessarily what you actually needed on the ground or do in the current role?
That's true. I think what worked well for me was that it just gave me certain transferable skills, like a thoda quantitative ability and understanding of government systems, all of that, which helped me. But the direct content or the subject matter that I deal with, that did not come from my degree. So that's why I was a fellow previously, where I learned and I shadowed a couple of people, and then I built my knowledge in the domain. So it wasn't a direct feeder like that.
However, was a career in this field, which is public service in some sense, a path which you had decided early on in your college years? And what prompted you? Was it a club or society, or meeting some seniors or alum, or even doing the first few internships?
So I think since school, I had an idea that this would be a very compelling domain. I would definitely want to explore it. I just did not have enough knowledge about what are the different options that exist, what are the skills that would be required. So when I went into college, actually, I think this is a very good thing about the DU ecosystem, that it gives you a lot of exposure outside the classroom as well. So there were a lot of seniors who were in different organizations, not necessarily grassroots, but who were working in the development impact space. And there was also this project I previously spoke about. There's this group in Actors in Delhi University, which is very active. They take up projects, and then it's very similar to what the impact space does, but at a very smaller student-based level. I think when I associated with them, and then through them, I got in touch with 10, 12 different organizations within Delhi NCR. I spoke to a lot of people. I tried to understand what the sector has. And then I think I remember going through a list of 50 fellowships in the sector to understand where all I can see myself. Public health wasn't the first choice, but I think when I spoke to people and I understood the kind of work happening, my filter was that it has to be a very grassroots implementation based role. I can always come back to Delhi, I can always come back to a design or a policy role, but an implementation role was at the core of what I was looking at. So I just went in for it then.
And so, in terms of internships, I know that some of the internships you did while you were in college were also in this field, like research,
Yeah.
server research foundation, some freelance work for them.
Yeah.
Also, being part of different clubs and organizations, like you already mentioned.
Yeah.
So, is there a trajectory that you could sort of say would be an ideal for a student who's interested in public health to pursue, which could maybe save them a few steps? Or you think it's a journey which everyone has to figure out, and it's not linear?
I believe it's not linear, but if you know that this is something you would want to explore early on, then of course there are certain things you can do to accelerate your understanding of the sector. So one of those things, working with a think tank, helps because that does not require you going away while you're in the college. You can do it remotely, and that basically helps you understand how data is looked at. Whatever programs are happening on ground, you can synthesize that data and see, okay, this is how this will impact decision making. That will definitely help. I would also say, volunteer with organizations, citizen-led organizations in whichever place you are, and there'll be a lot of, like, there are blogging groups, there are like forest walk groups. Well, these might not directly feed in, but they will give you access to a lot of people who might be working in this space. And I think just talk to a lot of people in this space, because some people will give you a very negative view, which is fair. I got it. Some people give you a very optimistic view, which is also fair. But then you will have to decide, even if you're at both the extremes, would you like any of that happening?
Awesome. Very often we see gifted kids shy away from doing impact work because they feel that it might not be something that financially is rewarding, or other misunderstandings that they have about this path.
Yeah.
It's kind of thankless job in the field, blah, blah. So what do you think are misunderstandings about this path on careers in this field as such?
A lot of. It's normally very difficult to explain what is actually happening, or if most of the people are from Gurgaon, I think a lot of people also don't understand if there's any need for the kind of work that is happening. So the first misunderstanding is the scope or the exposure that the space can give you. People think that it's often volunteering or charity, or things that they've seen just school say project mein ek din mein hum chale gaye. That is the idea of the impact space, but that is not true. It's a whole sector. Like, there is impact investing also, if you want to switch from a finance to a impact side role. And increasingly, I feel like the gap between not-for-profit and for-profit is also reducing, because a lot of the skills that you would use in a for-profit are very much needed in a not-for-profit. And I think other misunderstandings would be, the scope of the work, nature of the work.
Sure. Yeah, and that's true for even for-profits, right? You might think you have this fancy role, honor of this.
Yeah.
You start as a junior analyst at consulting firm or anything like that. So what do you think are the questions which will help college students or even younger high school students should ask to figure that this could be a path that they can pursue? What should they ask themselves, or maybe what could counselors ask them, so that the answers that they give some suggestion that they could be a good fit for careers in the public service domain?
I think the first would be a very obvious why. because this is not a very conventional choice, as you said, because yes, the compensation is lower than normal for-profit industry standards. So, A, are you ready for that? And do you have a family or a support system which will be okay with you pursuing something like this, which may have exit opportunities which are slightly lesser than a conventional path or a linear path that you take up? A, ask yourself that. B, the why. If it's just to explore, then maybe start out with an internship or a fellowship. Don't dive deep into it right now. But if you really, matlab, you think that you can sustain and you can live in a tier 2, tier 3, tier 4, matlab, you can get outside of the tier 1 metro ka idea and actually sustain there, not for a 2-day thing, but if you can actually go and stay there with communities, then this might be a good fit for you. Otherwise, don't jump into it. Other questions you can ask yourself is, matlab, this also takes a lot of matlab, there's a lot of empathy fatigue that comes in with this kind of a job, because a lot of people who come into the sector are very passionate individuals, and often if you're trying to sleep or you're trying to do anything, the problems keep occurring, and these problems don't have a very, like, you cannot AI or you cannot Google search a simple answer to it. There's no textbook answer to it. A lot of times the answer is not even in your hands, because you're working with the government machinery, which is naturally a slow uh, system. So if you're okay with ambiguity, if you're okay with uh, having to break down problems and they not going your way, like, you have to struggle with certain problems because they're not going to be entirely under your control. So if you're okay with that, come in. uh, if you're not, maybe take out time, do something part-time, and then take a call.
Wonderful. I think this is so useful. And empathy fatigue is a great phrase to sort of hang on to. In our work as well, like we always are in front of students, parents, and there are all kinds of demands.
That's true, because matlab, a lot of times the outcome is not that you've, I don't know, like, it's not a very normal outcome. The outcome can be a death, or the outcome can be something very serious.
Yeah,
So if you're okay with having that as a part of your life, then you can explore this.
definitely. In terms of aspirations, right? Like you said that yes, there is a certain type of individual who would commit to this, and but the aspirations to say go beyond
Hmm.
or why they chose this can also keep changing a little bit, right? As they get
Yeah.
more experience or join different projects. What kind of future aspirations would someone like you have? Would it be public service, go, do an MBA or UPSC, or even go for a PhD program, or just continue what you are doing and keep doing it better?
I think it will change. It will keep changing. But right now, how I see it, at least in the early years, I want to explore a lot of different verticals, like more than continuing within the same domain and like climbing up the ladder. I would like to see across different, like right now I'm in the public health domain, but I would definitely want to explore education, livelihoods, and then see how all of that together comes to shape outcomes. Because what I've realized is public health cannot be tackled individually. Like, you can have a lot of knowledge about health per se, but the feeders to that problem will come from education or livelihood. So I think right now I just want to have multiple kinds of experiences across the domain, and then maybe take a call of how I want to proceed.
Thank you so much, Alisha. Now I'm going to end with some rapid fire questions about other things that keep you engaged and happy and busy.
Yeah.
I know you've been a busy student in school and then at college. What are I know visual arts, performing arts, many other things have been your interest in the past. So tell us your journey in that, and how else do you kind of refresh your mind dealing with that empathy fatigue?
I mean, you don't have to deal with the empathy fatigue every day. That's all right. So I have liked performing arts for, I think, ever since fifth or sixth grade. I've really enjoyed theater. I've enjoyed singing and listening to music. So I mean, one of my best things is to just take a long walk with a lot of music, and that helps me out. Uh, I try to keep in touch with theater even in geographies where it is not very common. Wherever I go into the districts, I try to find a group and stick to it. In terms of visual arts, I think school gave me a lot of exposure to like sculpture making and textile designing and all of that, but I could not keep up with it as I uh, grew up and throughout college. But I think most of my extracurricular has also actually been like volunteering in the impact space. So like it's just been the one thing that pulls me out and just pushes me. Like if I know something's happening, if there's any new movement starting, I want to know what it is about and how people are going about it. That's been about it.
Thanks. This is not a rapid fire, but I just came to my mind that some of our students who are exploring impact and sustainable development goals is maybe sometimes the first go-to place,
Yeah.
the Global Goals website. And then they look at the targets that Global Goals have set and some of the interesting projects that are happening in that space as templates or ideas. Very often students look at building their profile, which I really don't like as a term. Should be more about chasing their passions to really figure out how impactful use their knowledge, skills, and values could be put to bring about real change. So, what is the best way to get a quick overview of not just the SDGs, but just the idea of doing something with an impact? And how do you tie it to your own self-discovery process as a student who's just theoretically trying to figure it out without really doing hands-on work? What would be the tools, websites, YouTube channels, whatever to look at to study this space? Not just public health, but could be any of the SDGs.
Okay. I think first of all, profile building isn't as bad of a thing because the sector needs people who are intellectually curious, and even if it is to build a profile, it's good. Come in, explore, give back. That's beautiful. In terms of building knowledge, as a student, I would say there are certain. So there's India Development Review (IDR). They publish a lot of articles and they have blogs about whatever is out and about in the development sector right now. There are certain governance toolkits. So you can just look for impact consulting organizations like Dalberg and
Bitspan,
FS,
idea.
yeah, Bridgespan, yeah. All of them have governance toolkits. You can go through it to just understand what is actually, what are the kind of problems that are actually needing people to be solved. Um, you can go through. Um, there's this article, I think I can share a link with you. It's basically a breakdown of how you can start with looking. There are 6 to 7 broad brackets which the impact space is broken into, and then multiple organizations under those brackets. Now depending on what your why is, if you want a grassroots experience, go to an NGO. But if you don't want that, if you want an academic sort of experience, go to a think tank. If you want like an international exposure, there are international multilateral organizations. So depending on that, there's a very nice breakdown of how you can get into each. And yeah, I think that's about it. Yeah.
Thank you. Yeah, that's really a wonderful sort of few pointers that can guide many of our students actually. And I'll definitely have comments and questions coming your way. And hope to stay in touch and see you at our office sometime soon.
Yeah, definitely. It's actually a very interesting sector. I hope I have not scared anyone. It's a very fulfilling sort of place to be in. And if you have a why for it, give it a shot. You might like it.
Yeah, come to think of it, like if you're on the field meeting people and compared to sitting in a very sanitized, air-conditioned office space of a consulting company where you're making spreadsheets and PowerPoints, which now AI can do better or whatever, at least, what is more meaningful is a question mark. And it could change for different people.
Yeah.
Trying to say what is better. But yes, in this day and age where AI has actually made us more glued to our screens, and if you're actually meeting people, traveling at the same time, doing some knowledge work as well, which is adding to the overall knowledge base of the problem that is so large, much larger than you at least, or us at least.
Yeah.
It's a very fulfilling career. So thank you and all the best. Look forward to following your journey in the future as well.
Thank
Thanks,
you.
Sameexa.
Thank you, Arjun.